as you guys probably know from perhaps participating in previous Grapevine Health events, this platform is for you, led by you. I'm just here to serve as a conduit of information and hopefully trusted information. So I like to open it up with really starting off with any questions that you may have to begin. We'll certainly go back into some of the questions that were previously submitted, but for those of you who are here, I'd love to be able to open it up to you, open up the floor and give you space. I want to introduce myself first so you know of whom you are receiving information. My name is Dr. Yolanda Hancock. In the social media world, I'm known as Dr. Yola, and I sort of lead initiatives in the space of Ask Dr. Yola so that folks can ask me pretty much anything. And if I have an evidence-based answer, I'll give it. If it's something that I do not know, I have no fear in telling my patients, my families, my community that I do not know, but that I will work hard to find the answer. My most important job is that of mommy. I have one 9-year-old little girl who may or may not come sliding through here as she gets ready to prepare herself after dinner. I work as a pediatrician. I have been a pediatrician for, goodness, almost 20 years now. I also work as an obesity specialist, but more of my work is really focused on nutrition and helping people optimize their health, not just simply through medications and those sorts of things. My goal really is to try to get people off as many medications as I can. So we do a lot of work in terms of nutrition and other natural ways of healing the body. I am a Reiki provider and a doula. And the last hat that I wear is that of a public health expert. So I get to wear all of those hats coming into this space. And I think it's important for us, especially as more information comes up and more questions come up, to have a clear understanding of the person who's speaking with you so that you understand what their background is and even potentially what their biases may be. So that's my background. Let's open it up. I'd love to hear from you guys before we jump into the previously submitted questions. Talk to me. Swain family, Mr. Amos, anyone who wants to unmute, raise their hands, whatever the format is you'd like to pursue your question. You could submit it in the chat if you'd like, but I am here to answer the questions that you may have. If you guys are still thinking through your questions, I have plenty that were submitted ahead of time and we can certainly jump into those, but I want to give space for those of you who may want to ask the question at the top of our hour. Not yet. All right, well, I'm sure as I answer some of the questions that were previously submitted, that more questions may come up, all right? Does that sound like a plan?
Dr. Yola, if no one from the group has asked yet, can I ask you a question?
Absolutely.
Okay, thanks. So I have 3 children and the oldest is 13, so he is fully vaccinated already. My next oldest is 9, and as you know, they just approved vaccines for 5 and up.
Right.
So he actually had COVID about 2 months ago. Is this like, what's my best bet with this? Do I get him vaccinated? Do I wait a little bit?
That's an excellent question, especially for little ones who have had COVID. That's probably one of the most common questions that I get outside of should my kid get the COVID vaccine, period, right? If my child had COVID, 1, does he or she need to get it? And 2, what should the timing of the vaccine be? The answer to the question is yes. Even for children who have had COVID-19, the infection, it is still recommended that they get the COVID-19 vaccine for a variety of reasons. 1, we know that even with regular COVID from back in 2020, it seems so long ago, but the original COVID-19, we do know that folks could get recurrent infections from the COVID-19 infection. That's number 1. Number 2, we're dealing with a bigger, badder version of COVID-19 with the Delta variant, which has more virus contained in it which means it's easier to spread. It also causes more significant infection. And we do know that folks who had COVID before are at risk for getting the Delta variant of COVID-19. So that's the second reason. The third is that we're going into the winter. And what we know with most coronaviruses, as is the case with a lot of our respiratory viruses like the flu, is that there's what's called seasonality, meaning that certain climates, certain temperatures and times of the year, you see these viruses show up even more in terms of them loving the space that they're in. Viruses are very temperature sensitive. And so the colder the weather sometimes, it allows for more growth of these viruses. So as we're going into the winter, it increases the likelihood of coronavirus numbers going up. We saw the same thing happen last year, right around the end of October. We started to see a little flattening of our numbers. And then starting in the beginning of November, the numbers started to creep back up. And it's anticipated that that part of that is this whole what we call seasonality to COVID-19. The fourth reason why children and adults who have had COVID-19 should still get vaccinated is that we know that the immune response that is created, those immune cells that are out fighting and making sure that we don't get severely ill from COVID, that over time, even with natural infection, that immune response starts to drop down over time, sometimes as early as 90 days. So if you've ever heard someone say, well, you should wait 90 days until you get the COVID-19 vaccine after you've gotten the infection, that's not necessarily the truth. It just means that after 90 days, you run the risk of your immune response starting to really decrease. And it doesn't really matter the severity of your infection. You could have a mild or moderate case of COVID and still see that decrease in immune response. Certainly with a more significant, a stronger COVID-19 infection, it means that your immune response will likely last longer. But for those, especially for children, most of them having mild to moderate COVID-19, mostly mild, it's important for us to continue their protection. And what we know based on data from our grown-ups is that when an adult has had the COVID-19 infection and then they get the vaccine, their immune protection actually lasts longer than either natural infection or immune protection. So you get sort of like the biggest bang for your buck when it comes to receiving the vaccine after having the infection. So for your baby boy, who's the same age as my daughter, I would recommend that he get the COVID-19 vaccine. In terms of timing, my mom, when she had COVID, she got her vaccine within 2 weeks because she wanted to leave Louisiana and come back here, back to Maryland. There really isn't a specific time period. I usually, as a pediatrician, I would recommend, because we know that the immune response that's triggered by the vaccine can be relatively significant, and your little one may have just recovered, and then we give them the vaccine where they may be a little bit achy, give them a little bit of time to be able to recover, but you have up to around 90 days before that immune response starts to decline.
Gotcha. Thank you very much.
You're very welcome. Other questions before we jump into, yes, Mr. Swain.
Good evening. My question is related to the rollout of the vaccine for the younger children. I know that for, when the vaccines first came out for adults, it was elderly and, certain categories first. So could you explain how that's working for the children?
That's an excellent question. It really is a lot different than for the grown-ups. For the grown-ups, because we had such a limited supply and such a significant need to protect our seniors, given that they were the ones mostly dying from COVID and being admitted to the hospital, we had to really prioritize our seniors and our frontline healthcare workers. For our pediatric population, we haven't had to do it as much. Initially, the thought was we would we'd prioritize children who had those diseases that put them at higher risk to be very sick from COVID. So children dealing with obesity, children dealing with asthma, children dealing with high blood pressure, heart disease, etc., and diabetes. But because we had one, ample supply, and two, we knew the importance of protecting children in total, most places across the country are providing the vaccine to all children without having to prioritize it. In certain areas, for instance, here in the DC metro area, the Children's National Hospital has prioritized the vaccine for children right now who have some of those chronic health conditions. But if you were to go to some of these community-based events, some of these school-based events, they're not providing any prioritization. It's really first come, first served as it relates to the vaccine. And so if you have a child and you're interested in getting them vaccinated, we're seeing across the country partnerships with schools, with our big box pharmacies like CVS, Walgreens, with all of our local health departments. They're all making the vaccine available. And there's a good number of pediatric offices that are also offering the vaccine. So if you have a primary care provider for your little one, what I would suggest is just call your primary care provider and ask them if they are providing the COVID-19 vaccine. And if not, do they have a list of places where you can get it? Excellent question.
Thank you.
You're very welcome. Ms. Finch.
Yes, good afternoon. I'm here in Tennessee.
Good afternoon.
Yes, I was just curious whether the tag of COVID, long COVID, long haulers, if that is also amenable to children. That's my puppy.
Puppy, sounds so cute. That's an excellent question as well. So what we know, based particularly on this 5 to 11-year-old population, is that around 8% of children who developed COVID-19 over this past about 19 months, nearly 10%, specifically 8% of children have acquired the long COVID syndrome. Within that population that's developed long COVID, there have been some very specific symptoms. So you guys likely know that when it comes to long COVID, it can be almost anything. Some folks have symptoms similar to chronic fatigue syndrome. Some people have what we call brain fog. Some folks will have issues with their lungs. Well, for our younger population, a lot of the complications that we're seeing are really neurological. We're seeing difficulty concentrating. We're seeing issues with little ones being able to get good sleep. And of course, if the little ones aren't sleeping well, that's also going to impact them academically. We're seeing in our young folks issues with mood, depression, anxiety, those sorts of things. So we really have to pay attention to the fact that children are not immune to COVID. That's one of the things that we hear a lot, is that children aren't really impacted by COVID. They don't need to be vaccinated. Well, nearly 2 million children between the ages of 5 to 11 developed COVID-19 over this past 19 months of the pandemic. And of those nearly 2 million children, nearly 10% of them have acquired long COVID syndrome. And so we have to really think about that in terms of making a decision. It's one of the things that I think about as a mommy when it comes to getting my daughter vaccinated, is the risk of things like long COVID and some of the other complications around our children getting COVID-19. Excellent question. I believe Ms. Amano. Ms. Kat Amano, you're up next. I think I missed your hand earlier. I want to make sure I give you an opportunity.
Oh yeah, I had a question from a friend with kids who said she talked to her doctor about the heart issues that can happen to some kids and how that's rare, but she doesn't know how to look out for it. And her doctor just said, oh, if they have chest pain, but she was wondering if there was something else to look for, or anything more specific in terms of guidance to look out for that.
I think that's a very important question, especially as we're considering the vaccine for our 5 to 11-year-olds. As you guys likely know, for our adolescent population, so for our teenagers between the ages of 12 to 17, we did see a slight increase in the risk of what we call myocarditis, which is an inflammation of the heart muscle, something also called pericarditis, which is an inflammation of the space around the heart. Now, it's important to pay attention to risk, right? For everything that I decide as a parent and as a pediatrician, it's all about benefit and risk. And we have to figure out, okay, what is the risk of myocarditis in this age group? What I will tell you is that we have to compare myocarditis in the vaccinated population to myocarditis among children who get COVID. That's how I'm making all of my decisions, both for myself to get vaccinated and for my daughter, because we have to be realistic about what the real risk is. We know that for every 1,100 people who develop COVID-19, one person will get myocarditis and a pretty significant case of it. For every 9,000 people who get vaccinated, one person will get a very mild case of myocarditis. So we have to really pay attention to what the risk is for each of those categories. In terms of the symptoms to look out for, the myocarditis has usually been associated with one of the two mRNA vaccines, the Pfizer or the Moderna. Within that, it's usually after the second shot, and it's about 5 days after that second shot. Little ones can sometimes develop fever. They'll complain definitely of some chest pain, but even before that, they may experience feeling tired, because as your heart muscle is irritated and inflamed, it's beating, but it's beating and irritated, right? And it'll cause little ones to be tired. You want to keep an eye out. If they usually can run up the flight of stairs really quickly, and it seems after about 3 or 4 steps, they seem to be trying to catch their breath, or they just seem tired, they're sleeping more. Those are some of the signs to look out for. We see it more often in our boys than in our girls, and that's a risk for all forms of myocarditis. You can get myocarditis from a cold. You can get myocarditis from any viral infection. You can get myocarditis from any viral vaccine. So flu vaccine, all of those. It doesn't mean you don't get vaccinated. It just means that we understand that there is a risk associated with the virus or the vaccine that protects us against the virus. The issue is, which is the greater risk? Is it with the virus or is it with the vaccine? And hands down, for every single virus that I've had to deal with as a pediatrician, the virus has always had a higher risk of heart inflammation, all of those severe, what we call adverse outcomes associated with either the infection or with the vaccine. And so those are the symptoms to look out for: fever, chest pain, shortness of breath, decreased tolerance in terms of exercise. And you want to look out for it about 5 days after having received the second vaccine, particularly for Pfizer or Moderna. Ryan, I hope that helps.
Thank you.
You're welcome. Ms. Swain, your hand was up first.
Hello.
Hi.
The question I had was for the 5 to 11s who are having long-term effects from the vaccine. Are these kids completely healthy before they get the vaccine, or are these kids who had underlying conditions prior to?
That's an excellent question. So the long-term complications are associated with COVID, the infection, not the vaccine. We just rolled the vaccine out for the 5 to 11-year-olds. They have been monitored through this past March. So these studies started in March of 2020. The FDA required Pfizer to follow them initially for 2 months. And then because of the concerns around myocarditis in the teen population, the FDA required them to follow the children for an additional month and a half in this acute phase of the study. They also required Pfizer and Moderna to add more children into the study. So they started out with around 2,200 children back in March. This summer, they added another 2,300. We did not receive the data from those 2,300 that the FDA reviewed. They only reviewed data from the first 2,200 children who participated, but we will be able to have access to that data sometime later on this year. In addition, the FDA also requires both Pfizer and Moderna, really all the vaccine companies, to continue what we call surveillance, to make sure that within this trial, with the children who participated in the study, that they continue to follow them over an extended period of time, likely into the next year. What we know based on all of the vaccines that we have used historically and presently, that since we stopped using the oral polio vaccine, there has not yet been a vaccine to date that has caused long-term symptoms that we did not identify immediately after having administered the vaccine. So as an example, a friend of mine, her child got the MMR vaccine, and it ended up getting something called thrombocytopenic purpura, which is a rare condition and usually linked to a family history of it, but sometimes triggered with either measles, mumps, rubella, or the vaccine. Because the vaccine triggered it, she continues to have it. It wasn't that it's a long-term issue, but something that resulted from her getting vaccinated, and then it continued. But we have not seen anything where we haven't seen symptoms for the first several weeks to months out, and then all of a sudden something shows up next year or the year after that. We've always seen acute issues associated with the vaccine. And I'll give you an example. The rotavirus vaccine that we use in our babies to protect them against the really nasty diarrhea that they get every winter, when that vaccine first came out, what we noticed immediately was that little ones were having these issues with their intestines that caused us to pull this vaccine off the market. They continued to do more clinical trials, put it back out on the market. We no longer saw those issues. It wasn't months out, it was an immediate effect. The same thing with a vaccine called meningococcal. We saw increased cases of something called Guillain-Barré. They pulled it off the market, redid studies, put it back out on the market. We no longer see those same increased rates of Guillain-Barré. Again, it was an immediate observation. It's one of the reasons why we have things like vSafe, which is what allows the public to report out their symptoms, just in case you believe that all doctors have drank the Kool-Aid and we will hide the data. You don't have to worry about that anymore because now community members can actually report out their symptoms. It's one of the reasons why we were able to identify concerns around myocarditis. We as healthcare providers still use something called VAERS, which is the Vaccine Adverse Event Reporting System. We've been using that since for the past almost 20 years. And so both of those places allow both our the community members and healthcare providers to be able to put data in. So there are no concerns. I don't have any concerns as a parent. I don't have any concerns as a person who received the vaccine that like a year later, 2 years later, 5 years later, that we're going to discover that this vaccine did X, Y, or Z. It's what happens right in the moment. And what I'll tell you is that based on the study results from the 2,200 children that were observed from March through now, is that some of these concerning outcomes like anaphylaxis or severe allergic reaction, Bell's palsy, which is partial paralysis of your face. We didn't see any of those issues in the pediatric population among the 2,200 children. And those have been really the most significant red flags as it relates to this, this vaccine. Now, back to the question that Ms. Amano asked about myocarditis, I'll be honest with you, there weren't enough children in the study population to honestly say whether or not there is risk of myocarditis because myocarditis is so rare. We would need around 13,000 children in this particular age group to have received the vaccine to even observe at least one case of myocarditis. And so as the vaccine continues to be rolled out and more children are receiving it, we continue to stay on high alert. It's one of the things that I'm paying attention to as a mom and as a pediatrician to see whether or not there is an increased risk of myocarditis in this age group. What I will tell you, just based on how they approached it, and figuring out what the appropriate dose is for our children, because children are not little adults. They are children and should be treated accordingly when it comes to things like vaccines and medications. Pfizer did a really great job in determining that children didn't need the full dose that grownups got at 30 micrograms. Instead, children only needed a third of the dose, only 10 micrograms to get the same immune response. And I certainly believe that for that reason, we're not going to see as many of these adverse outcomes and concerns that we did with both the adolescent and the adult rollout. Excellent question. Miss Simona, is your hand up?
No, but thank you so much for asking.
You're welcome. Mr. Swain, your question.
Yeah, I think you kind of already answered, but I just want to, get it out, I guess, directly. Is there any reason that somebody should not get the vaccine, a child?
That's an excellent question. So there are a couple of sort of categories where you should at least have a conversation with your child's pediatrician or other healthcare provider. One, if a child has had significant allergic reactions to other vaccines, that should be something to be of concern. We are not concerned about children who have allergies to foods like peanuts, dairy, etc. We have not seen sort of a cross reaction to food sensitivities with this vaccine. Two, if one of the family members has had a significant reaction after having received the COVID-19 vaccine, that's also something to be mindful of. What I would tell you, particularly for children who have significant food allergies, if my daughter has significant food allergies, I would likely want her to get her COVID-19 vaccine at her doctor's office or somewhere where there's like an EpiPen, some oxygen, something. I wouldn't necessarily do it at like the drive-through community event, knowing that there is even a slight risk of some form of allergic reaction. If children are dealing with significant immunocompromise where their bodies may not be able to have a response, a strong response to the COVID-19 vaccine, that's also something to consider. So we're talking about children who have recently had, really recently had a bone marrow transplant. At some point, they will need to get a COVID-19 vaccine in order to protect themselves because they are immunocompromised. But if a child just recently, like they just had their first chemotherapy treatment and there are no white blood cells to be able to mount an immune response, that's a conversation I would definitely have with the hematologist, oncologist. But otherwise, for children who have any chronic health conditions, obesity, asthma, diabetes, high blood pressure, sickle cell anemia, Down syndrome, all of those are categories that put children at increased risk of severe COVID-19 infection, the risk of hospitalization, and even dying from COVID-19. So those definitely are children that I would highly recommend they consider it. But if you have any concerns about whatever the specific health condition is that your child or your loved one may have, then it certainly means having a conversation with your primary care provider to talk it through.
Thank you.
You're very welcome. Yes, Miss Finch, ask.
Yes, you mentioned the word community centers, community drive-throughs. One of the things that has been concerning me is that as I listen to the media, they talk about where a family member could get a vaccine for their child. They mentioned the pediatrician's office, big box stores like Walgreens and so forth. I'm a part of a mobile vaccine clinic, which is made up of community nurses, volunteers, and so forth. And we've vaccinated over 80,000 individuals through our efforts. We go into the inner city, under the bridge, all different kind of places. So my question to you is, what is your thoughts about as we're putting together our ask in our community about being a part of the movement, the vaccine movement for children? Should we have any best practices as we have not done children, we've done only the adults and the 16 to 18-year-olds. So do you have any advice for us? Because we intend to make the ask because there is a population of community that doesn't have access, and we're not having vaccine um, clinics in our schools at this point. Is just trying to put our plan together.
No, I think, well, one, I just want to commend you for your efforts. You guys are certainly a leader in our community in the work that you're doing, and you are practicing medicine in the best way that it can be practiced by going to the community, as opposed to expecting the community to come to us. When we do that, when we do the work that you're doing, you remove a lot of the barriers, right, for people to be able to access resources inclusive of this vaccine. The first thing I would say, and this isn't in your ask, but it's certainly something that I would recommend, is you have to bring your patients. As you can imagine, providing vaccines to little ones, especially 5 to 11, there are some techniques that you have to incorporate that you would not necessarily expect to incorporate for grown-ups, right? So having things like stickers. So when you're asked, you make sure you have a budget for some stickers, because little ones need their stickers after they've gotten their shots. Having a way to help distract children. Parents are not going to be the best holders when it comes to having to give a little one an immunization. So the best thing to do is to have something that's going to distract them. I have in my office something called a Buzzy, and it's actually this little ladybug, and I have no stock in it, and it's not linked to Big Pharma. It's just an amazing tool that a physician, I believe, created. And what it does is it's a little wristband that you put around the little one's arm when they're getting ready to give a shot, and it just vibrates the arm. It gives a little tickle. It does two things. One, it distracts the child, and two, it vibrates the arm to trigger your body not to sense pain as much. Anytime you get the nerves in any part of the body to turn on, their perception of pain decreases. It also helps the child to relax their arm so that their muscles aren't so tight, which causes them even more discomfort. So I can, I'll put my contact information in the chat so you have it, so I can send you the link to the Buzzy. I would highly recommend. I use the Buzzy at my office to administer vaccines all the time, and it certainly does help in terms of distracting the little ones. But even more importantly, what I would say the most important piece is doing stuff like this, the community engagement piece of it, so that folks will actually come, because a lot of times we think if we build it, they will come. Parents are going to be more likely to get themselves vaccinated before they get their children vaccinated. One, because we've done a really good job of making people feel like children aren't as at risk. And that's, a huge part of what we've collectively done in the health space. The second thing is that parents are more apprehensive because they're like, I'll do whatever I need to do for me, but for my baby, I had to make sure I need to know all the details. I need to make sure that what I decide for my child isn't going to impact them a year from now, 5 years from now, 10 years from now. So really, in your space, having those trusted people, especially people like yourself, trusted community members that can speak to the vaccine, the safety of it, the efficacy of it, all of those things in a way that's relatable to our families who may or may not trust the medical system, and for good reason, right? But I think a lot of times we have not, since we knew the vaccine was coming out, we did not do as good of a job collectively throughout the country as we should have in terms of preemptive communication, so that our parents were ready to receive the vaccine once it was available. And so I would really spend a lot of time focusing on your communication strategy, partnering with community members, moms, dads who have gotten their children vaccinated. Let them be some of your spokespeople, so that it isn't just us academicians and clinicians and public health folks, but it's just Janice, mother of two, who felt comfortable enough with the science and the information made available to her to get her son, daughter, whoever vaccinated. That's how I would navigate through the space, and then identify who those champions are going to be as you continue to move forward.
No, great answer. You just gave me another idea. We had planned to have a pediatrician tent with a big sign to say, those are the pediatricians. We got them here on site. They're here, and so forth. But now I might just have me a mom and daddy tent too.
Absolutely. I highly recommend having parents, because like for me, me being a mom, it certainly helps. But if you already distrust the establishment, especially if the medical establishment has done you wrong, having doctors there to answer questions is excellent. But there's nothing like seeing somebody that is from where you're from and can relate to you and be like, look, sis, I felt the same way. I found out this, and this. My child got vaccinated 3 weeks ago. She's good. It was a little rough. She had a little fever. Her arm was a little sore, but we've had no issues. Or she was down for 2 days, but I'd rather that than have her down for 2 weeks because of COVID. The stories that our families tell and the relationship that they can establish sometimes works even better than relationship that I established with my own patients. Excellent question. You're very welcome. You're very welcome. So what I will do is I will jump into a couple of the questions that individuals submitted ahead of time, but I'll continue to survey the space to make sure that I don't miss any raised hands. This I thought was an excellent question. My child just turned 12. Why does he suddenly need to get an adult dose in his vaccine instead of the 1/3 pediatric dose? It's a question that I've actually asked. A friend of mine is a White House correspondent, and one of the things that I asked her to ask the White House was, does the FDA plan to ask Pfizer to revisit the dosing for the adolescent population? Because 12-year-olds, 13-year-olds, even 15-year-olds are still not the same as a 35-year-old. So the question is, will the FDA request that Pfizer revisit the dosing strategy for our adolescent population to determine whether or not they can get lesser of a dose? We do know that there were no cases of COVID among the adolescents who received the vaccine, but what we did see was a slight increase in the risk of myocarditis. So why compel a child who just turned 12 to get the full adult dose when, if he or she was 11 years old, 11 months and 364 days, he would still qualify for the 10 microgram dose? It's a question that I will honestly tell you I cannot answer, because it is actually a question that I have raised myself in terms of us rethinking how we approach the adolescent vaccine to determine if 30 micrograms was what our adolescent population needed. It doesn't mean that I'm opposed to our teens getting the Pfizer vaccine. It's just a question, I think, that warrants some answers as we navigate through, given the fact that our pediatric population only needed 1/3 of the dose. Next question, my child is small for his age. How do I know that the shot will be right for him? This really relates to questions that we've heard quite often about using weight as a way to determine how much vaccine a child should get. So in medicine, we use weight. In pediatrics, almost all of our medications are based on a child's weight. So a 6-month-old is not going to get the same amount of Tylenol that a 6-year-old would, right? Simply based on their weight. We don't do the same thing for vaccines, because we instead use how much of an immune response does a particular vaccine facilitate. We don't need to do that based on their weight. Their weight does not affect the dosing of the shot. So the same polio vaccine that I give a 2-month-old, I also give a 6-month-old, I also give a 4-year-old. We do not change the strength of it because it's not necessary in terms of triggering an immune response. When we're doing research to determine the efficacy or how well a vaccine works, it's based on how strong the immune response happens. If it means it's at this tiny little dose, then that's what we go with. And that's what science does, is it determines what is the minimal amount, or what it's supposed to do in most cases, what is the minimal amount of this vaccine that's needed to trigger the strongest response in terms of our bodies being able to fight against the infection. And so that's why we don't use weight. For someone who runs on the smaller side, if they're at like the on their growth curve, they're a little on the lower end of their growth curve, they still get that same amount of vaccine because it's not based on their weight, but based on how strong the immune response gets triggered, depending really on their age. For little ones under the age of a year, their immune response is going to be a little bit different than children who are older than 5, and different than children who are older than 11. That's why we use DTaP in our little ones, but in our big kids, we use Tdap. For all of those reasons, it's really based on our immune response. All right, I want to make sure I give space before I go on to the next question. And feel free, put it in the chat, raise your hands. If you're shy, put it in the chat. If you're not, go on and boldly raise your hand. You know I'm here to answer any and all questions that you may have. What do the studies say about any possible vaccine injury? We sort of talked about that in the 2,200 children that we looked at for this initial report. There were no reports of adverse outcomes, those really bad outcomes like anaphylactic shock, severe allergic reaction, Bell's palsy, etc. But we will continue to monitor for any of those as the vaccine continues to be rolled out. What do you feed a child who has been vaccinated with COVID-19? I think that's an excellent question. So one of the things that I talk about with my patients, and I push it out, I actually have information that I also share on my website at Ask Dr. Yola, is really preparing your body before and after, whether you're a little one or a grown up, making sure that you hydrate well, right? If your little one is struggling to get water in, now's the time to really start working on getting water in. You want to keep hydration flowing. I'm a big believer in energy, right? And water helps energetic flow within the body. So as you get this vaccine, and the vaccine triggers the body to do what it's supposed to do in terms of creating an immune response, you also want to make sure that you're moving whatever the leftover remnants of that vaccine are out of the system. You want to make sure that you are giving the body all kinds of good antioxidants. These are the kinds of foods that help to allow the body to create an immune response without triggering a lot of inflammation that causes you to feel fatigued, that causes you to have fever. So after I got my second COVID, even first COVID-19 vaccine, I went out and got an acai bowl. So acai, blueberries, cherries. These are the times to get in those good 3 to 5 servings of fruits and veggies. Your green leafies are going to be important. Cutting back on sugar. If you usually give them some Go-Gurts and you give them fruit snacks, this is the time to try to wean it off. You don't want to give them a whole lot of sugar because sugar triggers inflammation. They may be a little bit sleepy, so you want to encourage them to allow their bodies to just rest and do what their bodies do. This is an excellent time to go on YouTube and teach them how their immune system is creating a strong response. I used to teach elementary school before I went to medical school, so I see every single thing that we do for and with our children as an opportunity to teach them how their bodies work. So those are the kinds of things that I would do even before they go in. So they go in feeling all supercharged, like my body's about to show up and show out. Let's go, mommy. Let's go, daddy. As opposed to fully being fearful of getting a poke in the arm. Now they're coming in the same way we do as informed consumers. Why not let our little ones come into this space as informed consumers as well? So that's how I would sort of prepare, and that's how I will be preparing my little one to go get the COVID-19 vaccine, because a lot of folks will ask, well, Dr. Yola, do you plan on getting little mommy is who she's known as in social media. Do you plan on getting little mommy the COVID-19 vaccine? Yes, I do. She will be getting the COVID-19 vaccine, and we'll likely go together because I will be taking her when it's time for me to get my booster. We're going to do both at the same time so that I'm there to show her how brave mommy is and to support her as she gets the vaccine, because I think it's important for us to be able to do this together. So it's a significant moment in both of our lives for us to both collectively be protected against COVID-19. All right, I'm gonna stop for a second, make sure that I'm not talking too much, because I do have a tendency to do that, but I wanna make sure that I respect the space. I'm gonna check the chat and see if we have anything. Let's see. I got the vaccine, and people think that because I waited for a vaccine to get fully approved rather than getting the emergency one, I was just being paranoid. Evan, you are so not paranoid. You did what you needed to do, right? I will be fully transparent with you, Evan. I got the same feedback, right? So I could have gotten the vaccine in December of 2020. I've never been an early adopter of anything in medicine. New vaccines in pediatrics, new medications in pediatrics. I've never been the first to do it. And although we were in an emergency situation, given that hundreds of thousands of people were dying of COVID-19, and I have a history of asthma, and I have a senior mother who has chronic conditions that could have put her at risk, I had to be true to myself and what my level of comfort was. Was the science strong? Absolutely, Evan, back in December. But I had to wait till 10% of the population got the vaccine, which took until March. We reached a 10% threshold, and that's when I rolled up my sleeve. You would have thought I was an anti-vaxxer in December, January, February, all the way through to the middle of March. I took it in stride. I knew I had to be true to myself and what my comfort level was. In the meantime, in between time, I still did all the public health measures. I wore my N95. I maintained social distancing. I kept a very tight COVID circle until I got vaccinated. And even now, still maintain a fairly tight COVID circle. I think it's important for all of us to do what we are comfortable with. But we also have to acknowledge when we have enough information, right? There is sufficient information as of November 2021 for all of us to make a safe decision, especially as adults, right? Now, there have been now billions of people who have received this vaccine. And so it's important for us to recognize that we now, especially in the adult population, there is sufficient information. But if you had to wait for FDA approval, that's what you do, Evan. You don't let anybody, I don't think that anyone should feel pressured outside of employment, right? Because now we have employment mandates, and that's really to protect the collective space of a working environment, because employers end up paying the cost when folks collectively or in mass numbers come down with COVID. But from an individual standpoint, you have to do what feels good for you in terms of making this decision. But what I will say, which is what I've told family and friends, is that we now have enough information to know that, one, this vaccine is safe among our adult population and even among our pediatric population. We know that this vaccine is effective. Between 88 to 98% of those who are coming down with COVID and hospitalized with COVID are unvaccinated. Only a small, very small percentage of individuals who are vaccinated are ending up in the hospital or dying from COVID. So we clearly know, just based on math, that this vaccine is effective. And when people start talking about all these adverse outcomes, the beauty of this pandemic is that V-Safe was established. We've never had the capacity for our community members to actually be able to say, hey, this vaccine did X, Y, or Z to me. Previously, it was only those of us who worked in medicine that could report it out, but now community members can do the same. So I think that that is absolutely a great space. But, you know, I have to be truthful with you. I was also someone who waited a little bit. I didn't wait for FDA approval. I just waited for 10%. And the reason, if you guys are curious, the reason why I did wait it for 10% of the population is that in science, in studies, 10% of a population is a really good, what we call sample size. 10% of our population is a good reflection of the country as a whole, right? Certainly there's still some space to improve in terms of diversity. We have to do better. I'll tell you, for our pediatric vaccine, only a little less than 6% of the children who participated were African American. 21% of the children who participated identified as Hispanic, but we still have room for improvement in terms of how we navigate through this. All right. Let me make sure that I don't miss any questions. Let's see, will doctors be able to get children vaccine in the office, or will we have to go to those mass vaccination sites? That's an excellent question. There will be spaces. So here in Prince George's County in Maryland, where I live, they are giving the vaccine at this place called Prince George's County Sports and Learning. It's a huge gymnasium, but within the gymnasium are our public health officials. So it isn't just random folks in there. There are folks who have the capacity to respond to emergencies. And that's really the case for almost every space that you'll see. You're not going to see the same huge mass vaccination sites that we did with adults, but what we are going to see is community partnerships. So places like schools, elementary, middle, and high schools, you're going to see it. And as Ms. Finch mentioned, big box pharmacies, CVS, Walgreens, et cetera. There are pediatricians' offices that will have the vaccine. There are also public health departments within their free health systems that will also have the vaccine. Hopefully, there will be federally qualified health centers that allow families without insurance or are underinsured, that don't have sufficient insurance to have access to regular primary care providers, for them to be able to get this vaccine too. Because again, to Ms. Finch's point, there are some folks who will not have access or choose not to have access to primary care spaces to get this vaccine. And it is utilizing really unique, innovative ways like mobile units to be able to get families vaccinated. Hopefully we will see partnerships with churches where families are going to worship, churches, synagogues, mosques, et cetera, where there are also trusted leaders that will allow families to comfortably be able to come out and get vaccinated. All right, let me make sure. Good, we covered questions in the chat. I'll go back to the list of questions. Can they get regular flu shot at the same time? Excellent question, Ms. Smith. Absolutely they can. There is no reason why we as adults or little ones cannot get the flu shot and the COVID-19 vaccine at the same time. What I would say is to get one shot in each arm, because one, if there's any local reaction, allergic reaction, bumps, hives, et cetera, we want to know, was it on the flu side or was it on the COVID-19 side? We usually give combinations of vaccines from the time little ones are between 6 to 8 weeks. There really isn't a reason why we can't. I know that there are some concerns, depending on the space in which you live, about what we call over-triggering the immune system. Thus far, we have not seen any scientific evidence to show that that is something that we should be concerned about. I have, with my little one throughout her childhood, she has gotten a combination of vaccines. We have not yet seen in the adult population any issues related to getting the COVID-19 vaccine and the flu vaccine. We haven't seen any issues in the adolescent population as well. It's a little too early to say for our little ones 5 to 11 because we just started the rollout, but it's definitely something that I and all healthcare professionals are keeping an eye on, but we haven't seen any issues that put us at concern for not giving them at the same time, other than having to do two whammies at once, right? What I would say is have a nurse on each side if you can, just tag them up real quick, because most kids, once you poke them once, good luck trying to get them to get poked twice, right? My little one got her flu shot with me. Again, it's a group effort. We went and got our flu shots 2 weeks ago. We did it together. And then like I said, we're going to be getting our COVID-19 vaccine within the next 2 weeks when I'm due for my booster, right? Yeah, it was quite an adventure. But she knows, again, we talked about the importance of it. It's her beauty and curse of being the daughter of a pediatrician. She probably gets way more information than she wants, but she came in fully informed as a consumer. She knew where she was what she was doing and why we did it. All right. Let's go back to our submitted questions as I continue to peruse and see if you guys have any. Someone asked, what is the rate of death of a child from the vaccination? And I think this is a very important question to ask, just in terms of concerns around vaccine-related death. You hear a lot about this in social media, where my cousin got the vaccine and then he or she died, right? And there will be folks on YouTube that say more people die from the vaccine than they die from COVID, which is absolutely not true. There aren't more people dying from getting the vaccine than there are from dying from COVID. As you guys likely know, we now have lost over 750,000 people to COVID-19 in this country alone. When you go to VAERS and pull up COVID-19 and the symptom death, You will see of the now 230 million people who have gotten at least one dose, and close to 190 million people who have been fully vaccinated in this country. There is a report of around 6,000 people who have died around the time that they got the vaccine. But what we have to keep in mind of those 6,000 over this past 19 months is who got vaccinated at the start of this pandemic. It was our seniors, right? It was our elderly, initially 75 and older, and then those 65 and older, and those with chronic health conditions like diabetes, high blood pressure, etc. Not to say that our seniors were going to die anyway. My grandmothers who are 91 and 92 would pop me upside the head if they thought I said that. But we do know that the risk of death outside of the COVID-19 vaccine for our seniors is higher on its own, right? So that's, I always tell folks, correlation, meaning the timing of when you get a vaccine to when something happens, does not equal what we call causation, meaning that the vaccine caused people to die. So when you look at that information, it isn't that the vaccine caused 6,000 people to die, it's that around the time that they got the vaccine, 6,000 people did transition. But again, even if the vaccine caused death, which it does not, 6,000 among 220 million does not compare to 750,000 people who have lost their lives to COVID-19. When it comes to children, we have not lost a child to receiving the vaccine, not to my knowledge, but what we have done is lost 680 children to COVID-19 since this pandemic began. And to give you a point of reference, I always like to compare it to the flu, because that's really how we should compare children, not to adults, but to children dealing with other infectious diseases. At the height of the flu season, over a 12-month period of time, we have lost no more than about 190 children during a flu season. In the same 12 months with COVID, we lost over 300 children to COVID-19. So a significant increase in the number of lives lost in the pediatric population with COVID compared to flu. That's how I like to think about it in terms of risk. But we have not lost any, clearly we just rolled this vaccine out, the 5 to 11-year-old vaccine we just rolled out just last week. And so I can't speak to it. We know that if there was a child who had died within the 5 to 11-year-old population, we would have heard about it by now, but we have not seen that be an issue with this vaccine. But we have clearly seen issues with COVID-19 among our 5 to 11-year-olds. Hold on one second. And within this age group, we've lost 94 children to COVID within the 5 to 11-year-old age group. Let me make sure I don't miss any questions. Let's see. Hold on, I have a tickle in my throat. Let me get my back. There we go. I usually keep it with me. All right, what does COVID look like in a child when it's severe? How do you treat a small child gasping for breath? That's an excellent question. So one, in terms of symptoms when it comes to COVID, 80% of children have either asymptomatic, meaning they don't have really any symptoms, or they only have very mild symptoms, nothing more severe than like a pretty moderate cold, like a good amount of cough, sneezing, some fever, body aches. Sometimes little ones will have tummy upset. When it comes to severe COVID, you see very similar symptoms to what we see for grown-ups. So shortness of breath, what you just mentioned about gasping for air. Hopefully we will have not progressed to that point, but little ones will complain that it's hard for them to breathe. Hold on, let me get a sip. The thing we do have to look out for, especially in the pediatric population, is something called multi-system inflammatory syndrome. That usually happens about 2 weeks after a little one has actually had COVID. They can get inflammation of the lungs, they can get inflammation of the brain, they can get inflammation of their stomach, their intestines, you name it. That's why they call it multi-system inflammatory syndrome. What little ones will usually develop is a really high fever. They'll get red eyes, but not the goopy pink eye kind of eyes, but their eyes will just be red. They can get drying and cracking of their lips, rashes on their hands and their feet. It's similar to something that we call in pediatrics Kawasaki, which is a disease that we've been familiar with for a long time. It's very similar to that. So pink eyes, swollen lips, peeling lips, rashes on the hands and the feet, and usually some loose stools because it's causing inflammation inside the body. The biggest thing we have to worry about with multisystem inflammatory syndrome is the inflammation that it can cause the blood vessels that provide blood to the heart, our coronary blood vessels. Those are the things that we really have to keep an eye out for. Now, what's interesting, both with COVID-19 in terms of the children that we've lost with multisystem inflammatory syndrome, is we've been seeing more children in communities of color. About 75% of children who have developed multisystem inflammatory syndrome have either been Black or Latinx. Of the children who have died from COVID-19, over 55% of them have either been Black or brown. And so our children are in communities of color are experiencing this pandemic in a very more impactful way, which is one of the reasons why, especially for parents of color, we have to strongly consider getting our children vaccinated. In terms of when to call your pediatrician, both, we'll talk about both for COVID and for the vaccine. When it comes to COVID-19, the first thing you want to do, if you suspect that your child may have been exposed to COVID, I'd initiate that call immediately. Like half of my parent calls over the past month and a half since school began have been just that. School sent out a letter, or we think so-and-so in the class may have had COVID. Because the first thing you're going to want to do is get your child tested to make sure that you know what their COVID-19 risk is. And you want to make sure that you get them tested not too early, because if you get their noses swabbed too early, the test will come back negative. And you won't know if it truly was negative or if it was because you tested too soon. This COVID-19 needs enough time for the virus to grow, to reach a level that's actually testable. And that usually happens around 5 days after exposure. So that's the first call you make. We need to get them in to get tested. Or if you have access to like a mobile unit, now you can get a home-based test at like Walmart, Walgreens, etc. Once that test comes back positive, I would also make at least contact with your primary care provider so that they know what's going on. They may give you some specific recommendations, particularly if your child has something like asthma, anything like that. I always appreciate it when my families let me know what's going on, even if it's something as simple as a text. My families have a way, and I know this isn't the case for all doctors, that you can just text your doctor, but in my case, they can. They send me a text real quick and like, hey, doc, so-and-so has a COVID test, came back positive. What do we need to do? I shoot them a quick message to let them know what to do. But in cases of emergencies, if your little one is having, as we talked about before, shortness of breath, if they can't tolerate fluids, they haven't drank anything in over 12 hours, no urine output in 12 hours, loose stools, having more than 6 loose stools within a 24-hour period of time, they seem more tired. Those are all red flags to make sure that you seek out medical attention to get them taken care of. They also may give you some recommendations in terms of like things like vitamin C and all the other good natural things to help navigate you through. And just for some good peace of mind, I know both as a pediatrician, but even more so as a mommy, being able to talk to my daughter's pediatrician when and if there are any issues. And I know that sounds a little weird because you're like, you're a doctor, but I don't like to be my daughter's doctor. I like to be my daughter's mommy. And that's the lane I sit in whenever she's dealing with any health issues. I always reach out to her doctor so that she knows what's going on, all right? In terms of the vaccine, the most common side effects associated with the pediatric vaccine were no different than what we experienced as adults. Soreness at the site where they got the shot, what we call some lymphadenopathy, the lymph nodes underneath your arm can sometimes get a little swollen and tender. Little ones, a few little ones complained of that. A few little ones had fever and they just felt overall just tired and sluggish, particularly after the second shot. So you guys likely know with this vaccine, it's the same as the adults. It's 2 shots separated by 21 days. It was after the second shot that the most common side effects, or the things that the little ones complained about or parents complained about, were pain at the injection site, a little bit of swelling and tenderness around the arm, and a little bit of fever and just feeling tired. If fever goes up past 100.4 or 101 for the bigger kids, because we're talking 5 to 11. So if they have a fever of 101 or higher, I would definitely give the pediatrician a call. If they develop any rash near the site of the vaccine, I would also give your pediatrician a call. And clearly, if they're having any concerns about an allergic reaction, hives, lip swelling, any of those things that give your mommy, daddy, grandmommy, granddaddy, auntie, uncle, custodian, step parent flag raised, then do not hesitate. You will never be faulted for asking too many questions. You should always feel the space to be able to ask as many questions as you need to make sure that your children are safe. All right. What else? I know we're coming up on the top of the hour. I want to make sure that I don't miss anything. One of the other questions that I get that's often asked, especially for pregnant women and for parents of particularly little girls, are concerns around fertility and the impact that the vaccine may have on pregnant women. What I will tell you, I'll take that question in two parts. In terms of pregnant women, it has been recommended by every single organization and institution that connects to pregnant women. The American College of Obstetrics and Gynecology, the Organization of Maternal and Fetal Medicine, all of those organizations highly recommend that pregnant women be vaccinated against COVID-19. Initially, pregnant women were excluded from the initial clinical trial, but that's standard for any new vaccine and any new medication. If a woman is, or a person is potentially pregnant or can get pregnant, they're usually excluded from studies because we have to make sure that the vaccine is safe for the general population before we introduce it into any what we consider to be higher risk population, pregnant women and children. We now know that the vaccine has been administered to women who have eventually become pregnant, and then in women who are pregnant, they have now received the vaccine. There have been no safety concerns associated with the vaccine. What I will tell you is that COVID-19, again, it goes back to that risk benefit, right? With the COVID-19 infection, there are significant risks to the pregnant woman and to the fetus and to the newborn baby. Pregnant women who acquire COVID-19 are at increased risk of maternal death. They're at increased risk of pregnancy-induced hypertension. They're at increased risk of pregnancy-induced blood clot formation. They're at increased risk of premature labor. They are at increased risk of stillbirth for babies who are born to mothers who have COVID-19. I have two colleagues just last month who both lost the mothers to COVID-19 right after delivery. So, if I was pregnant of pregnant age, which I am not, I would certainly get vaccinated. In terms of breastfeeding mothers, breast milk is liquid gold. I breastfed for 2.5 years, so I'm all about team breastfeeding. The beauty of breast milk is that it truly is medicine, and the antibodies that are created from the mother are passed through into the milk. The COVID-19 vaccine hangs out in your body for about 3 days, and then that mRNA is broken up and booted out. But your immune response, that magical immune response that shows up in your breast milk, allows our little ones, especially between the ages of birth through 6 months, to be protected from COVID-19. So I highly recommend it. And I also clearly highly recommend that little ones continue through breastfeeding for as long as you can. All right.
Dr. Yola.
Yes, my
Sorry,
sweet.
I just wanted to jump in. We're almost out of time, so I just wanted to see if you wanted to take one last question. And
Sure.
And I just wanted to remind everyone we are back on the 18th and doing this again.
Absolutely, absolutely. I want to make sure I give space for anyone who may have questions in person before we go back to the questions that were submitted. Going once, going twice. All right, so I'll ask one of the other questions that was submitted, and then we'll delve more into some of these questions when we meet up again next week. So one of the questions that someone had was about specifically related to fertility and whether or not this vaccine impacts fertility. I want to make sure that I answer that specifically. What I will say is that there have been reports of women who have had menstrual changes after having received the COVID-19 vaccine, that their period either came earlier, it lasted longer, or that it was heavier. The National Institutes of Health are now dedicating funds to study this. But what I want you guys to understand is that a change in one menstrual cycle is not the equivalent of fertility issues. And the reason why I say that is twofold. One, anytime you trigger a strong immune response in the body, I don't know if any of you, particularly ladies, have had any sicknesses right around the time that your cycle was supposed to start. your period goes all over the place, right? Because the strong immune response also can affect the lining of the uterus. And it's suspected that that is what's going on with COVID-19, with the COVID-19 vaccine. But what we do know is that there have been over at least 20 studies looking at women of pregnancy age who have received this vaccine and whether or not there have been any differences in the ability to get pregnant, the ability to carry a pregnancy through to full term. There have been no differences in women who've been vaccinated versus women who have not. The difference has been in women who have had COVID-19, the infection. That has caused abnormalities in their menstrual cycles lasting for a longer period of time. Again, it's always looking at the risk versus the benefit. In every single issue that has been linked to the vaccine, there have been more of those same concerns associated with the COVID-19 infection at a more severe level. And so that's how we're navigating through. But just know that we are paying attention to these reports of changes in the menstrual cycle, but there are no concerns about fertility related to this vaccine. Yes, Ms. Smith, slide it in real quick before we get cut off. Yes, Ms. Smith, ask.
I think that might have been applause.
Oh, well, thank you.
and
Thank you,
much
guys.
deserved.
Thank you so much. We will see each other back. Feel free as you think through and allow this stuff to just marinate. Ask as many questions as you can. Write them down so that we can rock and roll for next week. I'm here for you. Invite friends and family, especially those that are really concerned about this vaccine. There is no question that I'm not willing to answer. And certainly for those who are, all charged up and ready to tell me I drank the Kool-Aid and that I'm a sellout, because that has happened. I entertain all of those conversations. I don't ever debate. I'm not ever going to be disrespectful. I honor everyone and their opinions, but I'm just here to help navigate us through as much as I can. Thank you, guys. I will see you next week, okay?
Bye-bye.
Bye-bye, my loves.